This PowerPoint is on diabetes mellitus. It's a new plan providing optimal proactive care for those in the nursing home. I'd like for you to take my pretest first, and then we'll continue. Diabetes is a condition in which the body either can't respond to or produce insulin. This can cause an elevation in glucose or blood sugar in the urine and blood. Insulin is a hormone produced by the pancreas. It facilitates passage of glucose into cells of the body, which is then used for energy. There are two types of diabetes. Type 1 diabetic is actually rare. Excuse me. Less than 200,000 per year are diagnosed. It appears during the adolescent years typically, and the cells in the pancreas don't produce insulin. There's no cure, and it requires lifelong care, which can be managed very carefully. The symptoms of type 1 include fatigue, hunger, excessive thirst, blurred vision, frequent urination, nausea, weight loss, and sweating. Type 2 diabetes appears in the adult years. It's a common condition in which the body may resist insulin or does not produce the amount needed. There is a possibility of remission with type 2, but it also can be lifelong and have many complications. Symptoms are about the same as type 1. It's fatigue, excessive thirst, frequent urination, weight gain or loss, poor wound healing, blurred vision, and excessive hunger. Diabetes is a common condition in the nursing home community. According to the National Nursing Home Survey, approximately 15% of nursing home residents are diabetics. Most who are diabetics are insulin dependent, requiring frequent, in many cases multiple times a day, blood sugar checks. Vigilance in the nursing staff is imperative for these patients for a favorable outcome. The results of inadequate care are vast and can have dire consequences. They include nerve damage, which can lead to amputation, kidney damage and or failure, heart disease, blindness, stroke, coma, and even death. The nurse must be proactive and not reactive. Vigilance and proactivity in the elderly community is a must in those with diabetes mellitus. This is especially true in the nursing home setting because chances are the patient will have other conditions in addition to diabetes, such as Alzheimer's, dementia, immobility, cancer, high blood pressure, and heart disease. These can all exacerbate diabetes. Patients with these pre-existing conditions may not recognize symptoms normally associated with diabetes. Alzheimer's patients probably won't remember to tell you to check their sugar. Not being vigilant can cause a busy nurse to forget a check, which can eventually prove deadly. Nurses in the nursing home typically have many more patients than in a hospital setting. These can be as high as 40 patients at a time. These patients can also be very unruly and difficult to care for, making it easy to overlook things. In this sometimes chaotic environment of long-term care, the nurse needs a system of checks and balances along with subordinates who share in the responsibility of care for these patients. It must go beyond the medication administration record. Although most long-term care facilities surely have computerized systems, it does not eliminate power outages or user error. Care for these patients also must go beyond finger sticks, injections, and medications. The nurse must delegate someone specifically to check blood sugars. This person must have computer access or a list that gives patient names and all specific check times. This person needs to not only input the information, but be aware of specific patient parameters on when to immediately notify the nurse. There should be periodic meetings related specifically to caring for these patients, knowing what and when to report, systems of a crisis, and consequences of mistakes. Those with diabetes mellitus need to eat a well-balanced, healthy diet. Nurses and all other staff must be aware of these diabetic patients. Kitchen staff can make mistakes when preparing food trays. Families may sneak snacks into the patients. Other patients may give diabetics foods and snacks they aren't supposed to have. Meticulous skincare assessments are a must. These need to be done no less than once a week, preferably twice a week on each patient. These patients can lose sensation in their extremities and be unaware of wounds that have developed. If not treated, infection can develop in these wounds and spread, causing serious illness. These wounds can develop rapidly. Foot care must be done by someone with knowledge of diabetic foot care, specifically in how to trim nails and inspect for developing wounds. It is important to include diabetic patients in their plan of care if possible, which gives the patients a sense of control. This improves patient outcome. Give patients choice of foods when possible. This can improve the chance of the patient eating, which is sometimes a problem. Malnutrition can complicate diabetes. Know a patient's baseline blood sugar. This can help to identify developing issues and avoid an emergency. If a patient tells you their sugar is dropping, believe them. It is easier to bring blood sugar down rather than up. Know individual treatment plans in the event of an emergency, or know where and how to get the information immediately. Know who to delegate to ahead of time in the event of an emergency. Nurses need to check expiration dates on insulin vials and pens and promptly discard any that are out of date. They generally last a month. Make improvements on and implement new protocol is the new plan. At the beginning of shift, all charge nurses to prepare individual patient emergency treatments and put in allocated space in the med room clearly labeled with name and any necessary instructions. Nurse to check expiration date on all insulin and promptly discard all expired vials and pens. Nurses to check blood sugars or delegate to someone trusted and administer insulin before the other patients with the exception of emergencies. This prevents getting busy with other patients, prevents diabetic patients from late meal consumption, especially those with, it's very important with unstable blood sugar fluctuations. Nurse to double check meal trays before passing on to the patient. Nurse to promptly begin scheduled skin assessments so as not to get busy, causing it to be overlooked. They must be thorough, checking between toes and fingers, under any skin folds, coccyx, and heels. Nurse to double check that diabetic patients always wear good socks and well-fitting shoes. When patient is bathed, it is a must that the caregiver dry all areas of skin, especially under folds and between fingers and toes. Diabetic skin needs lotion to prevent thickening and cracking. Nurse to delegate only when necessary. Have delegates who double check things. Nurse to check rooms for hidden or forbidden snacks. Remember, being proactive is the key. This plan is simple and ensures optimal care for diabetic residents in long-term care. It is proactive instead of reactive. This plan can increase quality of life and can include patient input where applicable. Thank you.